Well, I was met with my optometrist, and he suspects that I have a cataract in my eye, both of my eyes actually. So I thought, well, I better go see an ophthalmologist. And I had heard about Dr. John Goosey because other doctors send their families to him, and they see Dr. Goosey. I knew of his reputation and being someone who's one of the best surgeons around, so I figured I'd better go see him and see what he thinks. Well, I'm here at the doctor's office waiting for the exam, and you just think about things, and I'm reading information about cataract surgery and the different technologies they use to remove the cataract lens and put in a replacement lens. And it just makes you wonder a little bit. You know, having a surgery on your eye is always something you think about. But we'll see how it goes, and I'll be reporting back to you as my case gets concluded. After seeing Dr. Goosey, I learned that I do have cataracts in my eyes, and kind of felt like that was a little bit of a surprise at my age. He explained that the cataract surgery has changed a lot over the years, and the technology today is just very superior to anything that's ever happened. In particular, he talked about different kinds of lenses that you can have put in your eye to replace the cataract lens that would actually provide a ability to have vision correction at both distance, near, and intermediate. He called it a multifocal lens. So we decided that we would have set a date and have the cataract surgery done. So I started looking into it and learned that the Tecnis multifocal was a new lens that had really provided patients the complete solution of their vision correction. So I talked with him about that, and he had been implanting that lens, and we talked about some other lenses that were available, but the patient outcomes with this lens was pretty good. So I said, that's the one for me. And so we set up the date, and I'm going to have the Tecnis multifocal lens put in my eye. I also learned that there's some other technologies that he's using. As a matter of fact, I learned that of all the doctors in the Houston area, he was only one of two at the time of my surgery that offered this combination of technologies. Not only the multifocal lens, the Tecnis multifocal lens, but a new technology that actually checks the eye during surgery to make sure that the lens that's being implanted is the exact correct lens as far as the power to correct the vision. This is rather new and pretty interesting. Prior to this technology, doctors would estimate what that would be, and most of the time I suppose that was pretty accurate. But with this technology, it makes certain that the lens that's being implanted is the correct lens. It's, I believe, called the Aura system. I also learned that another technology that Dr. Goosey uses is called the Catalyst system, which is actually the most advanced way to remove the cataract lens, the diseased lens in my eye. This particular technology uses a laser to break up the lens and makes it much easier to remove that lens from the eye, decreasing the trauma and the side effects or the post-op problems that sometimes are associated with any kind of surgery. So I said, great, sounds like I've got the best doctor with the best technologies, so I'm ready to go. Well, today's the big day. I'm going to be here for my cataract surgery with Dr. Goosey, you know, it's always something you think about before any surgery, I guess. You know, you might have a little worry or a little anxiety about it, but I know I'm in good hands with him, and I'm excited about the fact that he has really the latest in technology that I'm going to be using. So here I am, and we'll see how the surgery goes. And well, I've completed my surgery now and headed home. I'm really kind of surprised. I have really no pain at all, nothing. We had the procedure. I could have some sensation during the procedure, but really it was much easier than I anticipated it would be. And it was amazing because when they removed the lens with that Catalyst technology, it was really done very quickly, didn't take long at all. And then we went into the OR where they actually removed the remaining particles of that lens and implanted the new lens, and that didn't take long either. Well, right after surgery, you know, the moment of opening your eye after the lens has been put in is always something you anticipate. And when I opened my eye, it was amazing. There was some cloudiness. Obviously, I just had surgery, but I was seeing very well. I was able to actually read my watch right after surgery, which I've never been able to do without the assistance of my glasses. I could look across the room and read some things on the wall, which I found to be interesting as well. I had never had that experience. And that was just immediately after the surgery. Well, the day after surgery, I was really surprised. My vision was excellent, and I just decided to go to work. I really had no side effects or problems. So I've decided to get up and head out to work, and we'll see how the day goes. I've noticed for the last several days that my vision just continues to get better and better. Not that it was really that bad even right after surgery. It's actually been very, very good. I'm just impressed with this Tecnis multifocal lens, how well I can see both distance, near, and intermediate. Working at a computer, I find it to be very acceptable and better than I've ever had since I was wearing glasses since I was a teenager. My vision is better than I can ever remember, so that's been exciting for me. Well, things just continue to get better for me. My vision is as good as it's ever been, and I'm here to see Dr. Gusi. At my last appointment, there's very little redness in my eye and no problems at all. So, you know, I feel now that everything I'd thought about or had heard or read about Dr. Gusi and the technologies he's using are really pretty outstanding, and I'm very glad that this was my choice.
I'm Jake Childress. I'm the refractive coordinator here at Dr. Gusi's office. I talk to patients about the different technologies and educate them about the different procedures out there and help them choose the one that's best for them. Here at Dr. Gusi's office, we specialize in getting people out of glasses. We have the new Catalyst femtosecond laser, which assists us in the cataract surgery. It's given us a huge advantage with patient outcomes. It makes the recovery from the procedure much quicker. The patient's vision comes around much faster, and it's made the procedure much safer. Here at Dr. Gusi's office, we're the only second practice in the state of Texas to get the Catalyst machine. It's really state-of-the-art equipment. There's nothing out there that's better, and we're very proud to offer that to our patients here at Dr. Gusi's office. For more information about the Catalyst femtosecond laser, watch this video from Optimedica. It'll help explain things.
The Catalyst Precision Laser System, the most sophisticated system for laser cataract surgery, is the product of an intensive effort by Optimedica. Research began in 2005 when a dedicated team of scientists, engineers, and interaction design specialists in Silicon Valley began collaborating with leading cataract and refractive surgeons.
We've built up prototypes, we've put them in front of ophthalmologists, we've tweaked and we've adjusted the ergonomics and the sizes and the positions of every part that's a touch point on the entire experience. Now they're saying this is exactly where I'd want it to be, and it just makes sense.
After 6 years of research and clinical studies, the resulting system utilizes breakthrough technology to deliver unmatched clinical results and a streamlined procedure. Optimedica has designed features that maximize precision, safety, and control at every step of the procedure. The first step is for the technician to plan the treatment, either immediately before the procedure or any time prior. Planning a treatment on the Catalyst graphical user interface is quick, intuitive, and template-based, which makes planning as easy as a few touches of the monitor.
As a surgeon, I will arrive at this Optimedica laser after the patient has already been placed on the bed, placed under the laser, after the software has been brought up that's already been predetermined for this specific patient. At that point, I can verify the software. If I want to verify any of the treatment parameters, I'm ready to do that. And then it's simply a matter of placing the lens, docking the patient, and doing the treatment.
The next step is engage, the process of securing the patient to the system. Catalyst uses the unique liquid optics interface consisting of a fluid-filled suction ring and a disposable lens. The suction ring is placed onto the patient's eye. Its 13.5 millimeter clear aperture allows the surgeon to center the suction ring on the limbus, viewing sclera around the pupil on all sides. Next, the suction ring is filled with BSS, and the patient is positioned under the laser. Assisted by on-screen docking aids, the surgeon connects the suction ring to the disposable lens using a joystick. The lens contacts the fluid, but does not come in contact with or applanate the cornea. Optimedica initially used a curved applanation interface, but determined that it did not deliver the optical quality required for precision laser treatment of the lens.
What we found was the curved contact interface actually deformed the posterior cornea and caused posterior corneal folds.
Relative to the initial curved lens design, Liquid Optics showed more than a 4-fold reduction in intraocular pressure rise in porcine and cadaver studies. Liquid Optics also results in a more gentle dock. Clinically, the extent of subconjunctival hemorrhages is reduced by 40%. The third step is visualize and customize. The Catalyst system's integrated video and 3D spectral domain OCT visualize from the anterior cornea through the posterior lens. Sophisticated algorithms automatically customize the treatment plan in 3D. Together, the process is called integral guidance. With integral guidance, Catalyst automatically centers the capsulotomy on the pupil, limbus, or scanned capsule. The system can detect ocular structures and customize the treatment plan even when the eye or the lens is tilted relative to the laser path. Integral guidance also optimizes the lens fragmentation depth by fragmenting deeply while maintaining adequate distance from the posterior capsule. With integral guidance, the surgeon plans the treatment in advance and, after the patient is docked, confirms the automatic surface fits and approves the treatment. This contrasts with a manual 2D approach, in which the surgeon manually identifies surfaces while the patient is under dock and manually maneuvers the position of the cuts.
And this extraordinary degree of accuracy that allows for precision and safety is a direct correlate of the ability to use OCT and integral guidance so that the computer can map out these areas with a level of accuracy and time efficiency that would simply be impossible by any other means.
From the time that the patient is under dock, time is of the essence, and patient comfort especially. So we've minimized the workflow such that it's streamlined.
The final stage in the process is applying the laser treatment. Catalyst uses a proprietary state-of-the-art fiber laser created specifically for this application. A Catalyst capsulotomy is delivered in less than 5 seconds. The combination of system software, the Liquid Optics interface, Integral Guidance's automatic surface detection, and the state-of-the-art laser resulted in unsurpassed clinical data in the prospective randomized study Optomedica conducted. This study evaluated the precision and accuracy of the laser capsulotomy and the ease of removal of femtosecond laser pre-treated nuclear cataracts. Capsulotomies created by Catalyst were just 29 microns from the intended diameter, a more than 10-fold improvement over the manual group. Circularity also showed a highly significant improvement. Finally, the laser capsulotomies were centered within 77 microns of the dilated pupil center. By pre-segmenting the nucleus and using patterns of cuts to soften harder cataracts, laser fragmentation has been shown to reduce the amount of ultrasound energy required. In the clinical study, 72% of patients had LOX grade 3 or 4 cataracts. When comparing the Catalyst group to the manual group, there was an approximately 40% reduction in the amount of ultrasound energy used. The Catalyst Precision Laser System, the product of more than 6 years of research, development, and refinement, combines several groundbreaking technologies that achieve unprecedented precision and a streamlined procedure. Intuitive template-based planning software, the Liquid Optics interface, integral guidance, and a state-of-the-art femtosecond laser. Catalyst, precision at every step.
Here at Dr. Gucci's office, we're also proud to offer the Aura machine, which is made by WaveTech. It's a machine that assists us in cataract surgery to help better choose the lens that we implant. Before, the old technology we had shot an A-scan on the eye, which we looked at a bunch of numbers and then tried to choose a lens that would be best for the patient. This machine actually works off the patient's biometry, so we shoot a measurement intraoperatively to help us pick the lens that should go in the eye, and the results are fantastic. Almost 90% are within a half a diopter of the target, so any technology out there is just second fiddle to this machine.
Introducing The Aura system, a revolutionary diagnostic device designed to take intraoperative wavefront aberrometry to a new level of precision. When a wavefront image is taken, a narrow beam of light is directed into the patient's eye and is reflected off the retina. As the reflected light passes back through the optical elements of the eye, it produces a wavefront image. Aura analyzes the wavefront reflected out of the eye by relaying it through an optical system and directing it through a pair of gratings set at a specific distance from and angle offset to each other. This creates a fringe pattern, which is captured by a camera and processed using proprietary algorithms to calculate refractive values based on the wavefront image. Optimized, on-demand performance. In your hands, the Aura system can optimize every cataract procedure.
Here's a video about the Tecnis multifocal implant made by Abbott.
As if I weren't kid enough, I feel like a teenager again with my vision.
My vision is just wonderful. It's like it was when I was young.
I feel like now I do see as well as I saw 40 years ago.
When we're young, many of us can see clearly at any distance, in any lighting condition, from objects up close to things far away, plus everything in between. At every age, we depend on our eyes to help us get safely to our destinations, absorb essential information, and spend quality time with family and friends. But over 50% of people over the age of 60, and quite a few younger than that, have the quality of their vision affected by a progressive eye condition called cataracts. In fact, cataracts are so common, it's said that nearly everyone will develop a cataract if they live long enough. Cataracts are a result of the clear natural lens inside the eye becoming cloudy, brown, or yellow. This causes light to be blocked and scattered by the lens, so it can no longer focus clearly on the retina. Vision becomes blurry, and colors lose their brilliance. Driving at night can also become difficult. At first, frequent changes in prescription glasses can help, but left untreated, cataracts could eventually lead to blindness.
It was terrible. I thought that I had been given the wrong prescription for my glasses, so I came back over here to the ophthalmologist and said, I don't think this prescription's right. It had been several months, and no, that prescription was right, but your cataracts have grown. I mean, it was bad. It was very hard to see.
Presbyopia is a common age-related condition. Beginning around the age of 40, the natural lens inside the eye begins to harden and become less flexible. This reduces the eye's ability to switch focus from near, far, in between, and back again. The earliest symptom of presbyopia is difficulty seeing things up close without the aid of reading glasses. Whether or not you are experiencing presbyopia, the only treatment for a cataract is to have the clouded natural lens of the eye removed and then replaced with an implantable intraocular lens, commonly referred to as an IOL. Surgery to remove cataracts is a safe and commonly performed same-day outpatient procedure. In fact, over 15 million lens implant procedures are performed every year worldwide. Today, when patients are diagnosed with cataracts, many doctors agree that the time to have them treated is when their quality of vision begins to interfere with doing the things they like to do most in life. And now, thanks to recent breakthroughs in lens implant technology, patients can not only resume doing the things they enjoy most in life, they now have the possibility of seeing like they did when they were much younger, before they became dependent on reading glasses. Now, patients are choosing to reclaim youthful vision with the advanced TECNIS multifocal lens. TECNIS multifocal intraocular lenses are indicated for primary implantation for the visual correction of aphakia in adult patients with and without presbyopia, in whom a cataractous lens has been removed by phacoemulsification and who desire near, intermediate, and distance vision with increased spectacle independence. The intraocular lenses are intended to be placed in the capsular bag. This implantable lens delivers high-quality vision at all distances, under all lighting conditions, both day and night. Even better, the TECNIS multifocal lens has helped thousands of people gain independence from glasses for the first time in their life. Nearly 9 out of 10 patients enjoy freedom from glasses after receiving the TECNIS multifocal lens.
It's really neat to watch my grandson play baseball, keep score. Before the TECNIS multifocal implants, I would wear my reading glasses so I could see what I was doing on the scorecard. Then I would have to look over them without benefit of bifocals or anything like that, and I would maybe miss a play. Now, I can look down at the scorecard, I can look up, and it's clear. I was told I've got 20/20 vision. The new TECNIS multifocal lens has made me feel like a young person again. As if I weren't kid enough, I feel like a teenager again with my vision.
Until recently, patients undergoing lens implant surgery received monofocal implants that had only one focal distance. Having monofocal lens implants in both eyes generally provides good distance vision, but patients often need reading glasses or bifocals for near and intermediate vision. As with many things, there may be a trade-off. If you decide to have a multifocal lens, your use of glasses may decrease, but at the cost of losing some of the sharpness of your vision. Even with glasses, this loss of sharpness may become worse under poor visibility conditions, such as dim light or fog.
I'm a retired optometrist. I've been retired now for 23 years and started playing golf, and it got to the point where at nighttime I just couldn't read road signs enough. On the golf course, I kept having to ask my playing partners, where did it go? My scores went up as the vision went down. So then I came to the ophthalmologist and we talked it over, and we decided that TECNIS was the one I really wanted because I wanted to be rid of glasses.
An overwhelming majority of people who have chosen the TECNIS multifocal lens are very satisfied with their vision following their procedure. In fact, 94% of patients said they would choose the TECNIS multifocal lens again.
My vision for all distances is just wonderful. It's like it was when I was young. I can see as well up close as I can at a distance or halfway in between. And the phone book, that's what really, that was the big test. After I got the TECNIS lens, I thought, I wonder if I can read a phone book now, because I could not read one anymore without a magnifying glass. And so I took the phone book out and I said, oh my gosh, I can read this. Before, when I would look at the yard, I didn't see the detail that I see now. It's so bright and brilliant now. The color is just so much more vivid. Every aspect of working in the yard has changed. It's a freedom to do anything as far as that goes. These are new eyes. That's what I tell everyone. I have new eyes. It's like a new world. I wake up in a new world every day.
Following the procedure, patients are usually allowed to return home in about an hour, and most people can resume their normal activities within a day or so. Everyone heals at a different rate, but in most cases, vision is improved within 24 hours, and continues to improve in the weeks following the procedure. There may also be some visual side effects, such as halos and glare from lights at night, that are more common than with a monofocal IOL. Halos are rings of light that you may notice when looking directly at a source of light, such as oncoming car headlights. Glare is a scattered light effect that can appear around a source of light. As the eye adjusts to the new lens over time, the visual impression of rings and glare typically lessens or goes away. Most patients report that the ability to see near, intermediate, and distance far outweighs any visual side effects they may experience. If you suffer from poor vision or think you might have a cataract, you should make an appointment to have a complete eye examination. Once it is determined that you are a good candidate for the Tecnis multifocal lens, you will be given additional information about the possible risks, complications, and costs involved with the procedure. Be sure to have all of your questions answered before giving your consent to have the procedure. A very small number of patients, less than 1% in U.S. clinical studies, may be dissatisfied and request removal of their multifocal IOL. Under poor visibility conditions, your vision may be reduced more than it would be with a monofocal IOL. Under these conditions, you may have more difficulty recognizing some traffic signs and hard-to-see objects in the road. Therefore, you may need to take extra care when driving, especially in poor light conditions. In rare instances, multifocal IOLs may make some types of retinal surgery more difficult. Although the thought of having any kind of eye surgery can be a bit intimidating, it's good to know that such a tremendously successful medical procedure has just taken a giant step forward. By providing even greater benefits and freedom from glasses, the Tecnis multifocal lens may give you back your youthful vision.
I know I'm getting old, but I don't feel a dadgum bit older now than I did 50 years ago. Now when I play golf, I have no need to ask anybody where the ball goes because I can see it further than they can. I contribute that entirely to the Tecnis multifocal lenses that we decided upon. I feel like now I do see as well as I saw 40 years ago.
Here's a video talking about the Restore lens, which is made by Alcon.
Living with cataracts is never easy. It's like seeing the world through a dirty window. Over time, the lenses in your eyes become cloudy, making images blurry and colors dull. The lenses in your eyes have a very important job. They take in light and allow you to focus your vision much like a camera lens. However, many factors from genetics to diabetes to exposure to ultraviolet light can cause your lenses to become cloudy, limiting your ability to see clearly. Don't worry, you're not alone. In fact, cataracts happen to almost everyone as they age. With so many excellent treatment options, your doctor can not only remove your cataract, he or she can potentially improve your quality of vision as well. Cataract surgery is a straightforward outpatient procedure that's performed thousands of times every day all over the world. Through a very small incision, your doctor will use sophisticated tools and techniques to remove your natural lens that has been affected by the cataract. He or she will then replace it with a synthetic lens that will allow light to travel correctly to your retina once again so you can see clearly. While every surgical procedure has its risks, cataract surgery is one of the most common surgical procedures and is one of the safest as well. Your doctor will explain this procedure and lens options in detail and answer any questions you might have. Typically, the basic cataract replacement lens is called a monofocal lens. That means the lens only focuses at one distance. Monofocal lenses have been used successfully in many patients and may be appropriate for your needs. A basic monofocal lens will remove the cloudiness you have experienced due to your cataracts. However, standard surgery with basic monofocal lenses cannot correct for pre-existing vision problems, such as presbyopia or astigmatism. And that means with a monofocal lens, if you currently wear glasses, it is highly likely that you will still depend on glasses or contacts after your surgery. See if monofocal lenses are right for you by asking your eye care provider. Cataract surgery is a very important decision. Equally important is the type of synthetic lens that you choose. Depending on your lifestyle and the anatomy of your eyes, you could choose a multifocal lens, such as the AcrySof IQ Restore lens. A multifocal lens can literally change the way you see. It allows for a range of improved vision, from near to far. Most patients who choose a multifocal lens are much less dependent on glasses or contacts, even if you've worn them your whole life. Just like it sounds, a multifocal lens has multiple focal points, allowing light to correctly focus on the retina at multiple distances. Just imagine seeing the world as it was meant to be seen and experiencing everything life has to offer, frequently without the burden and hassle of always depending on contacts or glasses. This proven technology has changed the lives of hundreds of thousands of patients, just like you, restoring not only their vision, but their quality of life as well.
I'm so thankful that my doctor recommended a multifocal lens. I had such a hard time using the computer before, but now I can see the screen.
Now I can see every word in focus without having to keep up with reading glasses all the time.
I still lead an active life.
As with any surgical procedure, there are risks involved. Some patients still need glasses or contacts even after receiving AcrySof IQ Restore IOLs. With the AcrySof IQ Restore IOL, there may be a loss of sharpness of your vision that may become worse in dim light or in foggy conditions. There is also a possibility that you may have some visual effects, such as rings or circles around lights at night, or you may also have trouble seeing street signs due to bright lights or glare from oncoming headlights. Ask your eye care provider about AcrySof Restore lenses.
Here at Dr. Goosey's office, we've taken a lot of pride in getting the best technology out there that's available for our patients. Our technology is specifically designed to help patients get out of glasses. So our combination of equipment's not found anyplace else in Houston. We have the Aura machine to help pick the measurements, the Catalyst femtosecond laser, our wide variety of lens options, whether it be the Tecnis multifocal or the Alcon Restore lens. All these technologies combined give our patients the best results possible.
I was actually quite excited to have the cataract finally to the point where it could be removed, because my eyesight in the last year had deteriorated, where I had reading glasses all over the house. Wherever I had to read something, there was a pair of reading glasses. And I don't really like wearing glasses anyway, and it was annoying. And so when he said, I don't think we can do anything more to help your eyesight, it's time to get rid of the cataract, I was in full agreement. There was no hesitation on my part. Lifetime profession was as a librarian, so I was reading and using a computer, and as I aged and the cataract started showing up, I noticed some difficulties there, and then once I retired from that profession, I went into doing fiber art and textile work 100%, and that's all very close work, sewing and handwork, and I was having trouble seeing things, even with the reading glasses, and I was upping the magnification for that kind of work particularly. The procedure was very simple. I was here at 6 a.m. and I was on the way home at 7:30, and there was no discomfort whatsoever, and I could even see as well as we were going home. Even though I had the plastic over my eye, my husband was driving and he came to a school zone, and I said, "You know you're in a school zone, there's a sign there," and he said, "You can read that?" And I said, "Yes." And so he was convinced also that it was a very good thing that I had done. It was definitely worth paying the extra amount that was required for the multifocal lens and having the cataract surgery and getting rid of the astigmatism. In a day, it had paid for itself as far as my eyesight was concerned. I really have not put the reading glasses on since I had the surgery, and I've already told them that they should do it, and I've told all my friends that we're going to have a party and they can take a pair of reading glasses home as a favor. And when I'm out with friends now and they're having trouble reading a menu or a price tag, several times I've been annoying and said, "Oh, well, let me read it," and I can.
I'm Jerry Speck. I've been a patient about 6 months of Dr. Goosey. My medical doctor, my general practitioner, recommended Dr. Goosey because his mother-in-law had come to Dr. Goosey, so he had really great things to say about him. Right, I had cataracts on both of my eyes, so they took the cataracts out and put new lenses in both my right and left eye. Okay, I had astigmatism and nearsightedness in my eyes, and so they put in a toric lens, so now I do not have to wear glasses. Well, when I first came in, I knew I had cataracts. So I went in and met with Trevor, and he did the eye examination, and they got to exactly how much astigmatism I had, how far nearsighted needed to be corrected. So about a month later, we decided to go ahead and do the surgery, December 19th. I did on my birthday. The day of surgery, I was kind of apprehensive, of course, because you're dealing with your vision, but it went great. The nurses in the operating room were wonderful. Dr. Goosey's procedure was very short and precise, and the recovery time was okay also. No, I was really surprised. The operation itself took, maybe it seemed like 10 minutes. Actually, I was waiting and they were putting drops in my eyes before the actual operation. Took longer than the actual procedure itself, and then I was out very quickly. No discomfort or pain after the surgery. It went much better than I was expecting. I was expecting to maybe have some things that happened, but nothing happened at all. It's been perfect for both eyes. Actually, I could see great my wife drove me home. Yes, it was worth the money that I had to spend extra to get the type of lens, the toric lens, that now I don't have to wear glasses at all for reading or for distance viewing. Feeling good. Don't have to wear glasses for the first time in over 40 years. Yeah, my vision, of course, I started wearing glasses when I was around 18 years old, so it's been a long time since I had vision that I didn't have to wear glasses, so it's been great. Well, yeah, just playing. I've got 8 grandkids, so playing with the grandkids, and I don't have to always be wondering where my glasses are or looking for them. I play golf, and I can see the golf ball better, farther down the fairway, and everything is just so much, clearer. It was. I told my wife I can get to wear some cool shades now. I've always had prescription shades. I've already told several of my people if they value their vision that they should come to see Dr. Goosey because he's the best.
My name is June Ronding. I ended up in Dr. Goosey's office because I was referred by my doctor at Northwest Optical. I like it because he called me by my name. When he came in to the examining room, he always called me by my name, and that is very comforting. The night before, I was scared. But then the next day, when I came in, I felt relieved, and I didn't have to wait very long when I was taken back to the surgery rooms, or the preparation room. And everything was just, it was good. It was fast. There was no long waiting period. It was over before I knew it. And when I went home, I just went home and did the eye drops and rested. And it was a lot smoother than I ever expected. No pain, no side effects. Everything was just like I thought it should be. Well, actually, friends told me that that probably would happen, that I would have halos, but I haven't really had that problem. Right away, I was back to doing whatever I wanted to do, and I could see, and I could hardly wait for the next eye to be done so everything would be 100%. When I heard about the multifocal lens, I decided to take the best because I deserve it. The quality of life, not wearing glasses is a big thing. I can wear makeup, and I've never worn makeup before because I've always just put my glasses on that kind of hide your face. But now I really enjoy being able to just walk around like no glasses. I mean, I just don't know how to say it. I have told all of my friends how wonderful it is. In fact, a girlfriend of mine decided to get her eyes done after I had mine done. Her only mistake was that she didn't come up here to get it done. Everybody here at Dr. Goosey's office is so kind and easy to get along with, and they've always made me feel very comfortable. I was just lucky enough to be sent to Dr. Goosey's office. I want to be 20/20, and that's what I have, and I'm very happy.
I'm Jake Childress. I'm the refractive coordinator here at Dr. Goosey's office. I talk to patients about the different technologies and educate them about the different procedures out there and help them choose the one that's best for them. Here at Dr. Goosey's office, we specialize in getting people out of glasses, doing refractive procedures, whether that be LASIK or refractive cataract surgery. Dr. Goosey is also a laser specialist. He specializes in refractive surgery to get patients out of glasses. The LASIK procedure is at the forefront of that technology. Our combination of equipment here at Dr. Goosey's office is only found at a few practices in the United States. We have the WaveLight Alcon FS200 and Allegretto Wave IQ 400 Hz lasers. They are the best combination of lasers that are currently on the market for LASIK. Nothing out there even comes close. The FS200 combined with the Allegretto Wave, which is the laser that we use for the correction, gives outcomes that have only been dreamed about before. The Allegretto, which is the laser that does the correction, there's a lot more of those lasers on the market. There's about 25 different LASIK lasers out there. All the other lasers but the Allegretto, they all induce worse night vision after surgery. They cause you to see halos, glare, starburst effect around lights at night. The Allegretto is the only laser on the market that's FDA approved to actually give you better night vision than what you had prior to the procedure. It does what's called an aspheric treatment on the cornea. That's how your cornea is supposed to be shaped naturally, with some asphericity to it. So not only better nighttime vision, but better daytime vision too. Most patients see better than 20/20 with this laser. As far as Dr. Goosey is concerned, he's done over 30,000 of these procedures. He stopped counting at 30,000, so I don't know exactly how many he's done, but he's done a bunch. He's a corneal specialist, which most LASIK doctors are not. They're refractive surgeons. The surgery is performed on your cornea, so it's nice that a corneal specialist is actually doing it. And pretty much any doctor you can find in the Houston area that's had LASIK, he's the one that did it. So this is where the other doctors and their families come to get the procedure.
Vision's going to be get better every hour. 6-7 hours from now, we'll be seeing pretty close to 20/20.
Okay.
Eyes could be a little watery and scratchy for the next 2 hours.
Okay.
After 2 hours, it'd be like a faucet somebody turned off. It's just going to stop. You'll hardly even know you had eye surgery.
Okay.
Coming up, we have a video from Alcon about the WaveLight, Allegretto, and FS200 femtosecond LASIK lasers.
Instead of using a bladed microkeratome, we use our femtosecond laser to create a customized corneal flap of the exact thickness, size, orientation, and location without the use of a blade. This level of control makes LASIK safer and allows more patients to qualify for LASIK. The corneal flap is then folded back. Using measurements from your eye's corneal curvature and biomechanics, the laser removes the corneal tissue necessary to correct your vision while creating a more natural, aspheric shape. In a perfect eye, the cornea, or outer window of the eye, is aspheric or egg-shaped. Light rays entering the center and the outer margins of the cornea all come together to a single point of focus. In some cases, conventional laser vision correction can create a more spherical or round cornea. This can create halos or glare, especially at night. Our wavefront optimized laser places additional laser pulses in the outer margins of the cornea to create a more natural shaped cornea. This allows light rays entering from the center and outer margins of the cornea to come to one point of focus, thereby reducing the incidence of unwanted nighttime visual side effects.
It's easy for me to talk to patients about LASIK because I'm a huge believer in it myself. I was really blind before I had LASIK. I was a -9, -9.5, which is severely myopic. I had really thick glasses and had to wear contacts most of the time because I couldn't see well out of the glasses. The LASIK procedure literally, it changed my life. The biggest benefit I got from the procedure is not the fact I see 20/15. I mean, I love my 20/15 vision, but the fact that I have perfect night vision. Before I had LASIK, I had trouble seeing street signs at night. I saw rings around lights. Everything looked distorted. Now I see perfect at night, crystal clear, no rings, no halos. So my night vision, and I really enjoy that when I'm driving at night. And when I was a patient, I researched, I looked into all the technologies out there, and hands down, the Allegretto Wave was the one that I wanted to choose. That's the one that keep coming up. All the doctors I talked to, even doctors that used other technologies, would tell me that the Allegretto was the better laser.
Functioning without glasses was impossible, whether it was close up or far away. I was in glasses all the time for distance, for near, for everything. I was in trifocals, actually. I had LASIK surgery in both eyes. It was reassuring to me that Dr. Gusi has done over 30,000 procedures. The day of surgery was more excited than nervous. And everything went really smoothly. When I left there, I could already see. When actually I couldn't function, I would have to feel around the counters for my glasses before I could do anything. And before I even left that day, I was already seeing very well. So most lasers are not able to treat people with high plus prescriptions like myself. I was a hyperope, and the Allegretto was able to do that with the equipment that Dr. Gusi has here. The surgery wasn't painful at all. After the surgery, I followed the instructions with the different prescriptions that they had given me, and just used a lot of the preservative-free tears. And over the course of maybe a couple of months, it just kind of everything normalized, and the vision is clear all the time. I would absolutely recommend this to anyone that's interested in having LASIK surgery with Dr. Gusi.
It was a very painless procedure, and I was back to work the next day. I'm really happy with my results. I don't have to wear glasses anymore. And to all my friends who are interested in LASIK, I would tell them to go see Dr. Gusi because he is the best.